When susceptible individuals exposed to the droplets of nuclei of patients with pulmonary tuberculosis, they can get infected. Infected individuals may develop disease. We have basically two kinds of disease, that is primary TB and secondary TB. Primary TB or primary tuberculosis, it is clinical illness that is directly follow the infection. They are common among children in their first few years of life. They can also be seen in immunocompromised persons. Usually, primary TB is mild and can heal spontaneously, but we can see some severe and disseminated cases of primary TB in our clinical practice. At the initial stage of the disease, we can see extensive growth of Mycobacterial tuberculosis with naive and activated macrophages. And the lesion can attract additional naive macrophages and form early granuloma. Without immunity to these pathogens, disease can disseminate widely through the lymph vessels. We've seen these pictures before. Clearly, we can see the extensive growth of Mycobacterial tuberculosis in macrophages. This is a typical picture of primary TB. After 2 to 4 weeks, two host responses develop. One of them is macrophage activating CMI response. What is CMI? CMI is cell-mediated immunity. It is a systemic immunity to TB infection. Another host response is a tissue-damaging response. The nature of this response is delayed type hypersensitivity to various bacillus antigens. This type of response can destroy unactivated macrophages containing multiplying bacilli and cause necrosis of the involved tissues. This DTH, delayed type hypersensitivity, they cause necrotic material resemble soft cheese. This is exactly where caseous necrosis come from. The liquefied caseous material contains large numbers of bacilli. They are highly infectious. When the liquefied caseous material expel out body by like coughing, cavities are formed. This picture shows a granuloma with caseous necrotic center. This gross pathology of TB patients' lungs show us that extensive lesion, especially in the upper lobe. We can see caseous necrosis and cavities, and also granulomas. If the patient have reactivation or reinfection of typical bacilli, then this patient have secondary TB or post-primary TB. These patients have established immunity So they have rare dissemination, but more cavitation, and they are more infectious.